of today, statistically, based on past years, we know that since Roe v. Wade was overturned, since that Supreme Court case was handed down, since our laws had finally been in effect after that court-delayed process, even that much time, we know that about 2,300 babies have been protected by law in Louisiana. How awesome is that? We should continue rejoicing. We should continue celebrating. We should continue lifting up each other in the pro-life movement that all the work we've been doing for the past 50 years that has led to this moment. It has been awesome. And of course now, as everyone knows, as everyone's been talking about, we're in such a nitty-gritty part of the movement because of the roots of abortion culture for the past 50 years. I need you all to know that chemical abortions are being mail-ordered into Louisiana. This is happening. Chemical abortions are dangerous, but they can be reversed. And pro-life people should be aware that mail-order chemical abortions are becoming rampant in a post-Roe Louisiana. So we need to talk about this. We need to spread education on exactly what those mail-order pills are and what they do and the risks and side effects that they can have on women and what we can do about it and how to counter this. We know that it's becoming rampant because our pregnancy centers have told us that people are calling about chemical abortions and worried about taking it. We had a counselor call here just the other day who, in counseling, had a young girl talking about needing to, just take a pill and it'll be done. And, she was in this crisis moment trying to figure out what to do. But this girl knew that she could get this mail order abortion pill. And this counselor didn't even know about us at Louisiana Right to Life, and she just kind of Googled and called, the first number, and I was able to talk with her and give her the information, in a nutshell that I'm going to give to you. And apparently, she's used it as a resource, her appropriate way in counseling. So throughout this chat session, I'm going to answer the questions: what are chemical abortions? Are chemical abortions dangerous? What is Louisiana's law on chemical abortions? What is the abortion pill reversal or rescue process? And what are mail order abortions? So what are chemical abortions? To break it down itself, I'm going to also link with this video, another video done by Live Action that shows you the whole process. But chemical abortions are often referred to as medication abortion or medical abortion. This type of non-surgical abortion uses pills to end the pregnancy. But we call it, a chemical abortion because unlike most medicine, which heals patients, this chemical concoction specifically and directly and violently ends the life of an unborn child. The most common chemical abortion method involves a two-step drug process. The first abortifacient drug, mifepristone, you'll also hear it, RU486, was given at the clinic and weakens or kills the baby by blocking progesterone. Blocking progesterone cuts off that nutrient system between the mother and the child, and also the way the child may be receiving oxygen already. So you are essentially starving and suffocating this child to death. And the second drug, misoprostol, is taken 24 to 48 hours later, usually at home, to expel the baby and complete the abortion. This is inducing early labor. Chemical abortions are supposed to be limited to 70 days or less since the first day of the last menstrual period. Y'all, it's so, whenever we hear of women who have gone through this process and, come out and speak out about it, they say that they were being told that this was going to be like an intense period. Y'all, even an intense period is not severe blood clotting. It should not make you describe your bathroom as looking like a slaughterhouse. These are quotes from people. And the pain had lasted for them even up to 3 weeks or more. This is more than an intense period. This is not the way you should be prepping women. And of course, so many of them are traumatized because of this. And of course, we'll go through the risks and how dangerous they are. And you can kind of guess how dangerous they are whenever you hear women describe it like that. Research indicates that the first drug, mifepristone, alone is not always effective at ending a life. A woman may still have a viable pregnancy after taking that first abortive drug, mifepristone. And we'll get into that with the abortion pill reversal protocol. So question number 2, are chemical abortions dangerous? Chemical abortions have a much higher complication rate than surgical abortions. Most common problems are severe bleeding and an incomplete abortion. Many women are often mistaken about their pregnancy dating. Remember, we said 70 days since the last menstrual period is when this should be taken, but So it has to be taken in early pregnancy. But without seeing a doctor and getting the accurate dating of pregnancy, women are put at pretty severe risk. The risk of death from chemical abortion goes up 38% every week beyond 8 weeks. So accurate dating is critical. Ectopic pregnancy can obviously make this extremely fatal. Without seeing a doctor, there's no way to rule out ectopic pregnancy before taking the chemical abortion pills. And ectopic pregnancy is when the embryo has implanted outside of the uterus. Even the FDA website itself states that women should not take Mifeprex if it has been more than 70 days since the first day of her last menstrual period, or if she has an ectopic pregnancy, she has problems with her adrenal glands, the glands near the kidneys, is currently being treated with long-term corticosteroid therapy, medication, has had an allergic reaction to mifepristone, misoprostol, or similar drugs, has bleeding problems or is taking a blood thinning drug, or has an IUD. An IUD must be removed before taking Mifeprex, according to the FDA. Yet, with the push of easier access to chemical abortion, especially mail order access, women are not even being seen by medical professionals to determine if all these factors are not going to come into play. When Mifeprex was first approved in 2000, the FDA imposed restrictions on its distribution. It was a part of a risk evaluation and mitigation strategy, REMS. So it's a safety program, and only a tiny fraction of drugs require the REMS program, but Mifeprex is one of them. In 2020, though, 20 years later, under the intense political pressure and COVID-19 pandemic, the FDA ended up exercising enforcement discretion for the in-person requirement, and in December of 2021, the FDA permanently removed the in-person requirement of the mifepristone REMS program. As of June 30th, 2021, there were reports of 26 deaths of women associated with mifepristone since the product was approved in September 2000, including 2 cases of ectopic pregnancy, resulting in death, and several cases of severe systemic infection, also called sepsis, including some that were fatal. So what is Louisiana's law on chemical abortions? Prior to this year, telemedicine abortions were basically illegal anyway. They said that the drug or chemical has to be given in the same room, in the physical presence of the pregnant woman when the drug or chemical is initially administered, dispensed, or otherwise provided to the pregnant woman. So it has to be the physician who prescribes it has to be present. In addition, we helped pass a law that requires that all women who take the first pill of chemical abortion are given information about the abortion pill reversal. And now, since Roe v. Wade's been overturned and we've been able to really crack down in our abortion laws, chemical abortion is illegal. You cannot prescribe it, you cannot sell it, you cannot distribute it. This is illegal in Louisiana. So what is the abortion pill reversal or rescue process? Well, women do regret their abortion decision, despite what others will tell you, despite what pro-abortion advocates will tell you. And it's clearly indicated by 150 calls a month to the abortion pill rescue network. And I'll link that in this video as well. A review of medical literature has shown that anywhere from 23% to 41% of women who attempted chemical abortion may change their mind, and this is based on 19 years of actual FDA data. For those seeking to reverse the chemical abortion, the goal is to start the protocol between 24 to 72 hours of taking the first abortion pill, mifepristone. And an ultrasound will be done as soon as possible to confirm the heart rate, placement, and the dating of pregnancy. So you have to go through all of that medical oversight first. The doctor or another medical provider will prescribe the progesterone given as a pill to be taken orally, vaginally, or possibly intramuscular injection. The treatment will usually continue throughout the first trimester of pregnancy. Currently, the Abortion Pill Rescue Network includes more than 500 clinicians willing to prescribe progesterone to patients who've initiated the medication process. We also really need doctors and other clinicians to sign up to be a part of the APR network. I mean, this is needed now more than ever, especially in states that restrict abortion. A study in Issues of Law and Medicine was released in 2018 that showed results of the protocol on 754 patients, providing further evidence. So there's, questions out there of, okay, is this dangerous? Is the abortion pill protocol dangerous for women? Will it cause, babies who have deformities because they've been starting the abortion process? And just generally, the pro-abortion movement is really trying to squash this information down. And I can understand absolutely that people would have questions about this. But the results really speak for themselves. 64 to 68% of pregnancies were saved through the abortion pill reversal. More than 2,000 babies have been saved through this process. There are 2,000 humans living on this earth that have actually been saved through this process. I think that speaks volumes for itself. There was no increase in birth defects at all. Lower preterm delivery rate than the general population. These were healthy pregnancies. Under this video, I'll give you several helpful links, including all of these things that I talked about, any studies that I mentioned. We have it in a fact sheet online that I will also link. Please join us for our upcoming webinar to go through the truth about our pro-life laws with Attorney General Jeff Landry and OBGYN Dr. Evelyn Griffin, she's been in our other videos helping to dispel myths, and she's pretty awesome. So please join us for that. That is Tuesday, October 25th at 7 p.m. You can register online. I'll link it as well, and we've been posting about it. Please join me next time on Post-Roe Chats.